You're listening to the Valley Current.
Welcome into the Valley Current. I'm so happy to have with us today Dr. Tom Krummel, who I've known now for decades, and he is such a fabulous guy. And I thought, God, if I could get 20 minutes of his time, and then of course some judge this afternoon took a lot of the time, so we had to reschedule this. But thank you for being so flexible.
No worries. A pleasure, and treasure our friendship.
No, and you did such a wonderful thing. I have to sort of make a record of it, which is that my daughter, who is going to give birth next month, as you know, ends up falling down a flight of stairs and breaking her ankle in, I don't know, a gazillion places. And she was at a hospital that no one had any confidence in. And you really helped her find the right doctor and the right department and the right entry into Stanford. And she and I are both forever grateful for that. That was just so wonderful. I mean, I have to say, everyone in my household was crying, hearing your voice as you reported what was going on.
Well, anyhow, I think that's what doctors do, and so I'm glad that she's on the mend.
So Tom, tell us a little bit. Yeah, I know a lot of the background of you, but tell us a little bit about your journey to get over to Silicon Valley. From what I'm recalling, was the East Coast, right?
So Midwestern kid. I grew up in Wisconsin for 25 years, undergrad and medical school. They wanted me to stay, and I just wanted to go someplace else. And through serendipity, wound up in Richmond, Virginia for 6 years, Pittsburgh for 2 years, back to Richmond for 5. And then again, through a piece of serendipity, wound up at Penn State for 9 years. It was in my time there that I got interested in things that the Valley was pioneering. Read simulation, AR, VR, and robotics. And because we actually got pretty good and knowledgeable when Stanford was looking for a department chair that knew something about the intersection with computer science, it turned out to be, as we say, maybe a marriage made in heaven. And so 21 years here and great colleagues and friends. And it's been amazing to think about a building like the Clark Center, where we are currently housed, was a parking lot when I got here.
Right. And Stanford keeps building. You have inspired me to ride my bike to work, because no one likely knows, or few people know, and I'm one of them, that you did a cross-country bicycle ride tour for like 44 days or something, right?
Yeah. Just like Noah, it was 40 days, and we started in Santa Barbara and finished at the Isle of Palms on the coast. There's a great tradition where when you take off from the West Coast, you put your rear tire in the Pacific Ocean, and when you get to the Atlantic, you put your front tire in the Atlantic. And so we did that, and was a great adventure.
What was the remind me of the time frame? Was it September, or when did you do it? Like 5 years ago, right?
Mid-September to the end of October. You're trying to hit a spot of relatively good weather, not too hot, not too rainy, days still relatively long, and the highest temperature was 116, and the coldest was 28 degrees. So even in that sweet spot, we had some shit weather on both ends.
Well, you guys that are in your 30s, you just amaze me at what you're capable of doing.
Right. Times two and a fraction.
Well, I have to say, and you aspired me to lose. I've lost about 25 pounds because I'm routinely riding from home back. And when you add that mileage, and I like to say, when I was in graduate school in New York, I used to ride from home uptown. Home was Brooklyn, over the Brooklyn Bridge, uptown to 81st Street, 6 days a week, back and forth. And I had just an unbelievably athletic body. I mean, just unbelievable.
I think part of the price we pay for our civilized living is that the human animal sort of takes a beating, and we don't train it enough, and we eat and drink too much, and it's not hard to lose it. And I think, it's all about habits. And if you can get that kind of groove going, I won't say it's easy, but 25 pounds is no mean feat. So kudos to you.
Well, I got about another 50 to go to really get back to a picture that if I could find it, I would put it on the screen and say, is that really you? I can't believe it. And I will eventually show it to you. But let me ask a question, which is, when you did that ride, did you ever regret it? Or did you say, man, I am going to make it. There's nothing getting in the way of this. I don't care. Rain, hail, sleet, trucks, noise. Was there any moment in time in that 40 odd days or exactly 40 days where you really just said, man, what did I get myself involved in here?
Yeah, multiple times. Well, funny story, the bike mechanic at Palo Alto Bicycles, when I was talking to him about it, said, well, what do you think is going to be the most difficult distance? And I said, there was a 140-mile day, Continental Divide. He said, no, you don't understand. The toughest distance is going to be the 6 inches between your ears. And
it's a mental game. It's very much a mental game.
It was a gigantic mental game. The good news is, having trained as a surgery resident for 9 years, where, it was back in the days of the 120-hour weeks, you got used to simply continuing. And the only way you don't complete it is by stopping. And so it was a matter of saying, okay, I'm going to go 10 miles. Let me get 10 miles in. Okay, well, let's do another 10. Well, how about another 10? Pretty soon it's time for lunch and you're halfway through the day. And so simple, as simple as that and as hard as that.
Are you doing any type of mantra mentally along the way? Because I could tell you a story, which is, I have a very athletic wife, PhD from Stanford, Dr. Lee Suter, very smart, very capable. She's like a super athlete. She's like you. She looks like she's in her 30s. And she runs up Windy Hill in Portola Valley. I, of course, try to catch her. But inevitably, when we're done with the 22-step round trip, the way we do it, I have to put ear pods in on the way down to sort of get my mind off the pain, or what you might call off the stress. I won't even call it pain. Just the notion that your legs are getting a little overtired. The lactic acid is building up. You know the chemistry of this, the biochemistry of this. But I'm curious, did you do anything? Because I don't think they allow you to put earphones in when you're riding on a bicycle these days, do they?
So I think I would never ride with earphones.
Right.
Except I did have to do one board meeting. So for 2 hours, I had earphones in, but happily sort of a nice wide shoulder. But to get to the point, your ears are your first defense, for vehicles that are coming behind you. And, you can't see them, but you can hear them. And so that's the only time I've ever ridden with anything in my ear.
So when you did that board meeting, did you feel like you were more in the zone because your head was pretty much in the board meeting virtually while you're pedaling and you're on mute? You're on mute.
It was also pretty funny because, it was pretty funny because I didn't have it on mute and they wondered what all the heavy breathing was about. And I assured them and took a quick picture to validate that this was simply from bicycle exertion.
So you're on the board of a few companies, and let's spend a few minutes talking about what you're seeing happen in what I would like to call the coming fifth industrial or informational revolution, because we've had basically the first, the second, the third, arguably we're in the fourth, but we're transitioning rapidly into the fifth. This idea that we're going from like basic delegation in the first revolution, where you have some tiny bit of machinery that's starting to do things, electricity is turning on, steam locomotives are happening, cars are being developed, to the second where we have telecommunications happening and people are starting to realize, wow, we're all connected in some way, to the third where computers enter the picture and the computers are doing some interesting stuff, but it's all decentralized. And then boom, the internet comes in the fourth in a huge way. And now the internet has introduced this ability to have AI and blockchain and big data helping people understand patterns in ways that humans can only partially understand. You're doing stuff I know at Stanford and also in what I would call your sort of venture / angel investing. What are you seeing? Am I overstating the way things are evolving here? Because to me, I've only been here for 40 odd years, and I see a lot more change than I saw in the first decade of that revolution. I mean, remember my law firm, these guys are still around. We started Apple Computer. Jobs and Wozniak walked in. We were like idiots. We didn't take their stock. That's a story for another day. Thereafter started Electronic Arts, Oracle, lots of other companies. But I'm kind of curious. What are you seeing?
So 25 years ago, I wrote an article that said the surgeon of the future will rehearse an operation the night before on patient-specific data and deliver the perfect data set of the operation with robotic assistance the next day. So that was the vision 25 years ago. We're not there yet. Back then, people were very leery of autonomous robots, the notion that the robot would go crazy and turn into a wearing blender. And so a lot right in Asimov's laws of robots and fail-safe things that were built in. Now we take self-driving cars for granted. They're probably safer than human-driven cars. And so I think we are seeing increasing robotic autonomy based on 3D imaging. A privately held but substantially capitalized company, Procept Robotics, is working on using a water-powered jet to remove prostate tissue when it's overgrown. And when you begin to accumulate the data set of individual operations, aggregate them into how did 1,000 of those operations benefit the patient, you can indeed begin to inform what you do based on learning patterns that would otherwise have been impossible. So I think you understate. I think that the whole notion of learning, applying some value associated to what actually happened will inform lots and lots of procedures, device deployments. The notion that devices are no longer static but are data gathering devices, I think, is very compelling. Early stage startup with a tiny implantable pressure sensor the size of a grain of rice could be enormously informative in ways that we've never been able to. You go to the doctor and you get your blood pressure checked once a month. What the hell does that mean? Nothing. But so continuous monitoring, I think all those things are in ferment as we speak.
Within the range of what you might call the next 10 to 20 years, or you think it's more like 40 to 50?
No. The next 3 to 5.
Wow. That's a big insight.
And Moore's law continues to be in our favor, right? And at a certain point, the challenges and the costs of producing higher and higher performing chips become problematic. But the human being is insatiable in their desire to solve problems. And when you tell a bunch of smart people you couldn't possibly make a faster chip, they will, and they'll say, "I told you so."
Right. I mean, the thing about the computer industry is people get into like game-like behavior to beat whatever was the last record. And yes. I don't know if we yet have that notion in medicine. I was talking to someone today about if medicine proceeded in the same way in which electronics proceeded, in the last 50 years, I have to believe that people would live to like 200 and we'd have no disease. And any pandemic would be like, hey, we planned for that. Just take this vaccine. We're done.
Mm-hmm. I think to some extent, we see that, for example, there's a fascinating book called Every Second Counts, and it retells the story of 4 heart surgeons who were in a race to see who would do the first human heart transplant. And one of them, of course, was Norm Shumway, a dear colleague and friend at Stanford. The other was Chris Barnard, that everyone knows or was aware that while Shumway did all the work, Barnard did the first one. And there are certain parallels to another great book, The Perfect Mile, that chronicles 3 runners who were all trying to run sub 4 minutes. But I think that's a minority of physicians that see the world that way, and the vast majority are trying to get through the list of patients they're supposed to see that day. And they're honestly so busy getting that work done that it's a little hard to think boldly about doing something very different. I think the other piece that's tricky with physicians is that we tend to practice to norms, and we practice what we were trained for, because there is this notion of standard of care. And anytime you deviate from standard of care, in theory, you're off the reservation. And if it goes well, okay. But if it doesn't go well, you could always find someone that contended that, you did a bad thing, and then the tort system takes over. So medicine has been historically conservative like that for many of those reasons.
So you would say, look, what you have to understand is when you're dealing with plastic and silicon, we can sort of manipulate, bend, fold, and mutilate it, and there's destructive testing. But when you're dealing with human flesh and heart and blood and lungs, there's only so far you can go, and then you run into problems like Elizabeth Holmes had.
Yes. Brooke Byers did the Fogarty lecture this past year, and he commented that the tolerances in technology for a crappy product are pretty broad.
Right.
The users will fix it, right? Facebook releases an edition. The users complain, they fix it, and away it goes. And, the old move fast and break things, that works okay for social networks and sharing graduation pictures. But the minute you put a human being in the mix, there's a different set of risks, and therefore an attendant much higher expectation for judiciously exploring those risks as you develop and institute new tools, technologies, devices, and the like.
So do you think of it as, because of the human aspect, and even with this pandemic, I guess we're still calling it a pandemic, but even with this pandemic, and even with people in the pandemic saying, hey, I'm willing to be kind of like a guinea pig. And apparently there are a lot of people like that are saying, I'm willing to be a guinea pig. Let me be a guinea pig. I'm fine being a guinea pig. Do you think at the end of the day, we're in a situation where it's likely that we'll always have sort of a much more difficult bar to jump over? That is, because you can only go so far with people, even with volunteers.
Yep.
A vaccine for this COVID-19 is not going to happen until, a year or two from now.
Well, so think about, in order to make a vaccine, a drug company is going to have to build a factory and spend $1 billion to develop that vaccine. Spend $1 billion. You can be sure they ain't going to do that until they're confident that it works. And while some of our politicians are delighted to bash the big pharma, there have been a hell of a lot of contributions that have resulted. And right now that, we're looking to them to be the cavalry, whether it's in the development of antibodies, the convalescent serum treatment, and ultimately vaccines.
So when you think about the current situation we're in, which obviously is either, the glass is half full. I said to someone today, look at the air quality in Paris. They're showing pictures. It's unbelievable. Or the glass is really half empty, which is maybe this is the beginning of Rome burning, and we're going to see a completely different lifestyle, work style, and so on. I have lawyers I know that literally have gotten laid off, and they've called me for advice. And usually it was always, where do I get my next job? They're like, I'm thinking about changing my career out of law. And I say, you've only put 25 years into this. I've got over 40. Are you sure you want to do it? And they're like, maybe it's time. Maybe it's a big signal. Are you seeing that in medicine too, where the medical doctors are getting burnt out?
Well, look, there's not a dermatologist in the country that's doing anything these days, right? There's not an orthopod that's, for the most part, doing elective joint replacement. Everything is sidelined. So, there'll be layoffs, furloughs, reductions in force, fractional working for a while. You may have seen in the last 2 days, Wall Street Journal, a number of the hospital chains are now looking at loosening where the number of viral cases is peaked. And it's believed that you could begin to do cancer procedures. It'll be a while before we do facelifts. I do think, Jack, that this is going to be a little like aviation post 9/11. Pre 9/11, you could walk down the concourse with your spouse who was going to get on a plane and you'd wave goodbye, and now you can't. And now it's gels and 3 ounces and plastic bags and take your shoes off. I think there will be a irrevocable change in the way we think about the ability to spread infectious diseases as a result of this. And those that figure out how you do social distancing, decontamination, testing will, there's the opportunity that's, and I tend to be a glasses half full kind of guy. And I think, the history of progress in medicine, when the famous French military surgeon for Napoleon, Ambroise Paré, was surrounded in the Battle of Turin, he ran out of boiling oil, which was how they used to treat wounds. And, you can imagine the effect of boiling oil on living tissue. So he stopped doing it, and the wound care improved remarkably. So deprivation, a problem, an unsolvable problem, suddenly became an opportunity for a radical reshift and a great advance. So I think we need to keep that kind of optimism, that kind of opportunistic thinking, to look around and say, okay, so what do we know now in the new world? And I'd say that's what we're trying to teach at BioDesign, the Fogarty Institute, and all of the early stage startups that I'm privileged to work with.
Which is a lot of startups, and I'm kind of curious, are you seeing them stressed out because the financing people are like, we're not doing anything until maybe third, maybe fourth quarter? So
yes, I mean, everybody is stressed out. Cash is short, runways are short, and it's one of the startups is supposed to be in the middle of animal testing. Well, we're not doing that right now. Another one was in the middle of a large clinical trial. That's in the toilet. It's even worse than that because the patients already treated aren't coming back for follow-up. It's really gonna make a hash of things. And in a cash-strapped business where investment's been thin, there's going to be some losers. That said, I think there's a growing awareness of the value of healthcare and healthcare providers compared to the Kardashians.
So you might see this as a shot in the arm to increase health literacy in ways we could never have imagined before.
I couldn't agree more. I think, and also some of the nuances, right? This whole notion of the statistics of crash course in biostatistics for anyone that wants to read. Unfortunately, many don't really want to read. They just want to kind of parrot whatever their favorite politicians got to say.
Right. I mean, politics is playing a larger and larger role, and maybe this is the best thing that could have ever happened to Obamacare and Medicare for all, if that's ever going to happen in our lifetimes.
Yeah, I mean, you look at the Western world, we're the only nation with 15% unemployment within the last 5 weeks as a direct consequence of a infectious disease.
So other places have actually addressed it better, is what you would say.
Yes.
Comparatively.
And where healthcare is not a condition based on employment, and where the ability to hunker down and the social support thing is more compelling. And
do you see this as playing in some way in the future generations that we can hope will be as positive as you're expressing? I mean, I'm sort of similar to you in the sort of things will get better, not worse. But believe me, I've got at least half of my clients who are strapped for their next funding And they're like, we're not sure there's going to be a Silicon Valley in the next 10 years. And I said, that's hard to believe, but they're like, maybe it's just ready to shift to a completely different, move to Oregon, move to Montana, move to some place where the land is cheap and the price of construction is low, and the houses, you can buy a house for less than a couple $100,000, not here where you can't even buy a place to park your RV for that price.
No, you're right. And look, that chapter hasn't been written. And I think that, the dreamers and the builders and the architects that won't sit for that are sitting in their offices thinking. Remember, it has been said that while he was quarantined, Isaac Newton discovered the laws of gravity and invented calculus. Shakespeare was quarantined and wrote, I think, The Merchant of Venice. So, again, I'm a glass is half full and we should make the most of it kind of guy. I think panic has never been a success strategy.
I think that's a good place to wrap up on. And I'm just curious, Tom, you're still in charge of the hospital, the children's hospital at Stanford, or maybe you just exited out of that. Remind me of where you are.
Yeah. So I've exited out of that, and so I don't have administrative responsibility at either hospital. Working mainly on the runway and early stage medical technology in the University of Biodesign at the Fogarty Institute, a not-for-profit medtech incubator.
Right. So if I could drag you into some of these Florence Venture startup meetings, you might have a little bandwidth for me, is what it sounds like. Maybe.
It would be a privilege.
No, seriously. I'm being serious because I always say to people.
I am being absolutely serious.
Well, that's good because I say to people all the time, you are one of the top 10 people in the medical biotech world that I would go to for any of these startups that we see that often they're not even worthy yet of putting in front of you. So I screen you out of a lot of noise. But when I get one that's signal versus noise, I will be all over you.
No. And as a matter of fact, I mean, literally, I had a Zoom meeting at 2:00. A guy that trained with me 20 years ago here at Stanford, who's now a heart surgeon in Syracuse, and he, email, hey, we got an idea. Could we Zoom? And so I love doing it. You learn something from it. Hopefully you provide a little advice and hopefully a little value.
Well, I'm going to call on you. And so hopefully we'll do another one of these when you have more time, either next month or later in this, summer and maybe fall, because I think there are so many topics that are coming up where AI is playing a larger role, and you can provide some real interesting insights about the trends you see. I've always said when I grow up at some point, I'm going to have $1 billion fund that's going to be able to help a lot of these startups kind of help the world in a big way. It'll have a big corporate social responsibility. But, I'm not fully grown up yet, so I haven't gotten there.
Yeah. Well, it remains useful and valuable, right? Making a fidget spinner, that's worthless.
Right.
Solving a problem in health and human disease, that has value, and that's always sort of driven me in that direction. Even if the other roads are easier and maybe more lucrative.
So once I get down to my early college weight of when I was able to easily do 6 days a week of bicycle riding from Brooklyn over the bridge, over the Brooklyn Bridge to uptown Manhattan, we're going on a 40-day ride together, right?
Yeah, count me in.
Or maybe in Italy. Maybe we'll do it in some other location than the U.S. But if you're up for doing the U.S., I would certainly be up for taking advantage of all the knowledge you have from the previous ride.
It'd be fun to schedule a bunch of them. It was just 4 years ago that we did a big ride in France. In Italy, in the Dolomites, and so those pictures are popping up on Facebook. There are lots of beautiful places, and don't forget how beautiful California is. Mount Hamilton, Mount Diablo. You want to go to the Eastern Sierras. That's like riding up the biggest Alps in the world.
Well, I knew you were going to talk about climbing. I just want a straight, flat road to ride on to start. But I hear you, and I'm up for it. So I'm going to start planning, and I'm certainly going to get the weight reduction. And then you're going to say, wow, Jack, you look like the way you looked about 50 years ago. And we're going to celebrate.
It's honestly the best thing you can be doing for yourself. You notice that the comorbidities for everything, weight happens to be one of the leading comorbidities of almost everything.
Well, Tom, thank you for your time. I'll look forward to another chat. I'll try to schedule with you because I've got a lot of
let's do it next month.
Absolutely,
let's do it next month.
We'll do it. I'll put it on the calendar and send you an invite, and we'll do it again.
Look forward to it.
Bye-bye. Have a good time.
Yeah, love to your family.
Bye-bye. You too.
Talk to you. Bye-bye.
Tune in next time on the Valley Current.